संवदध्वं संवदध्वं संवो मनांसि जानतां देवाभागं यथा पूर्वे संजानना उपासते संजानना उपासते संजानना उपासते.
Now slowly drop down your hands. Release legs one by one. Fold your legs backwards. Then, while kneeling down, with the help of both the feet, come to standing posture. Now, prepare yourselves for yoga practices. Now, we will start with neck bending movements. Stand with the feet 2 to 3 inches apart. Keep the hands straight beside your body. This is Samasthiti, also called as Tadasana. Keep your arms on the waist. While exhaling, move the head forward slowly and try to touch the chin to the chest. While inhaling, move the head up and bend backwards completely. This is one round. Repeat 2 more rounds. Now, right and left bending. While exhaling, bend the head slowly to the right. Bring the ear as close as possible to the shoulder without raising the shoulder. While inhaling, bring the head to the normal position. Similarly, while exhaling, bend the head to the left side. Now, inhale and bring the head up to the normal position. This is one round. Repeat 2 more rounds. Now, right and left twisting. Keep the head upright. While exhaling, gently turn the head to the right so that the chin is in the line with the shoulder. While inhaling, bring the head to the normal position. Similarly, while exhaling, turn the head to the left. Then inhale and bring the head to the normal position. This is one round. Repeat 2 more rounds. Next, neck rotation. Exhale, bend the head forward to touch the chin to the chest. Inhale, slowly rotate the head clockwise in a circular motion. Exhale while coming down. Do a full rotation. Then rotate the head in an anti-clockwise direction. Inhale, go back, and exhale, come down. This is one round. Repeat 2 more rounds. Move the head as far as possible. Do not overstrain. Keep the shoulders relaxed and steady. Feel the stretch around the neck and loosening up of the joints and muscles of the neck. Now, shoulders movement. Keep the feet together, the body straight, and the arms by the sides. While inhaling, raise your both arms sideways above your head with the palm outward. Exhale and bring it down in the same manner. Palms must be open with fingers together. Now, shoulder rotation. Stand erect. Place the fingers of the left hand on the left shoulder and the fingers of the right hand on the right shoulder. Full rotation of the elbows in a circular manner. Inhale and raise your elbows and bring them back when you exhale. Try to touch the elbows in front of the chest on the forward movement. Stretch the elbows back in the backward movement and touch the side of the trunk while coming down. Now, trunk movement. Keep the legs 2 to 3 feet apart. Raise both the arms up to the shoulder level with palms facing each other. While exhaling, twist the body towards the right side so that the left palm touches the right shoulder. Come back with inhalation. Now, while exhaling, twist the body towards the left side so that the right palm touches the left shoulder. Come back with inhalation. This is one round. Repeat it 2 more times. Do it as slowly as possible with coordination of breathing. Cardiac patients shall do with care. Avoid this practice in case of severe back pain, vertebral and intervertebral disc disorders, and during menstruation. Now slowly drop down your hands and relax in Samasthiti. Now knee movement. Inhale, lift your arms up to the shoulder level, palms facing downwards. Exhale, bend the knees and bring down the body to the semi-squatting position. In the final position, both the arms and thighs should be parallel to the ground. Inhale and straighten the body. Exhale while bringing down the hands. Repeat it 2 or more times. Avoid this asana in case of acute arthritis. Now Tadasana. Stand with feet 2 inches apart. Interlock the fingers and turn the wrist outwards. Now inhale, raise the arms up above your head. Raise the heels off the floor and balance on the toes as you raise your arms. Stay in this position for 10 to 30 seconds. This asana brings stability in the body, helps to increase height up to certain age. Avoid lifting the heels in case of acute cardiac problems, varicose veins and vertigo. While exhaling, bring heels and arms down, release the interlock of the fingers and come back to standing posture. Now Vrikshasana. Stand with feet 2 inches apart. Focus on a point in front. Exhale, hold and bend the right leg, then place the foot on the inner side of the left thigh. The heel should be touching the perineum region. Inhale and extend the arms up and join the palms together for Namaskara Mudra. Stay in this position for 10 to 30 seconds and breathe normally. Exhale, bring the arms down. Release the right leg and bring it to the initial position. Repeat this asana from the left side also. This asana helps to improve neuromuscular coordination, balance, endurance, alertness and concentration. It tones up the leg muscles and rejuvenates the ligaments. Please avoid this practice in case of arthritis, vertigo and obesity. Now Padahastasana. Stand straight with feet 2 inches apart. Inhale slowly and raise the arms up. Stretch up the body from the waist. Exhale and bend forward until the both palms rest on the ground. Stretch the back to make it straight as much as possible. Maintain this final posture for 10 to 30 seconds with normal breathing. This asana makes spine flexible, improves digestion, prevents constipation and menstrual problems. Please avoid this practice in case of cardiac and vertebral disorders, abdominal inflammation, hernia, glaucoma, vertigo, and during pregnancy. Now inhale, come up slowly to the upright position and stretch the arms straight above the head. Exhale slowly, return to the starting position in the reverse order. Then relax in Samasthiti. Now Ardha Chakrasana. Stretch the back at the sides of the waist with the fingers. Try to keep the elbows parallel. Drop the head backwards, stretching the neck muscles. As you inhale, bend backwards from the lumbar region. Exhale and relax. Stay here for 10 to 30 seconds with normal breathing. This asana makes spine flexible and helps in cervical spondylosis. Inhale and slowly come up. Avoid this posture in case of vertigo and hypertension. Now Trikonasana. Stand with your feet with 3 feet apart. Inhale slowly. Raise both the arms sideways up to the shoulder level. Now turn the right foot towards the right side. Exhale, slowly bend to the right side and place the right hand just behind the right foot. The left arm straight in line with the right arm. Turn the left palm forwards. Turn your head and gaze at the tip of the left middle finger. Remain in the posture for 10 to 30 seconds with normal breathing. Then inhale, slowly come up. Repeat the same procedure from the left side. This asana prevents flat foot, strengthens calf, thigh and waist muscles, makes the spine flexible, improves lung capacity, and found beneficial in the management of lumbar spondylosis. Please avoid this posture in case of slip disc, sciatica, and post-abdominal surgery. Do not try beyond the limits and overdo the lateral stretch. If one cannot reach the feet, one can reach for the knees instead. Come back in same manner and relax in Samasthiti. Now Bhadrasana. Come to sitting posture by bending knees one by one. Sit erect with both the legs stretched forward. Support the back with the hands. Body should be relaxed totally. This is called Vishramasana. Now put the soles of your feet together. Exhale and clasp your hands together over your toes. Inhale, pull your heels as close as possible up to the perineum region. If your thighs are not touching or are not close to the floor, place a cushion underneath the knees for support. This is the final position. Stay in this position for some time with normal breathing. Please avoid this practice in case of severe arthritis and sciatica. Now Vajrasana. From Sthiti Dandasana, fold the right leg at the knee and place the foot under the right buttock. Similarly, folding the left leg, place the left foot under the left buttock. Place both the heels so that the big toes touch each other. Position of the buttocks is in the space between the heels. Keep both hands on respective knees. Keep the spine erect. Gaze in front or close the eyes. While returning to the original position, come back in same reverse manner and relax in Vishramasana. This asana is good for digestion, strengthens thigh and calf muscles. Persons suffering from piles should not practice this asana. Now Ardha Ustrasana. Come to Dandasana, fold your legs and sit in Vajrasana. Stand on your knees. Place the hands on the hips with fingers pointing downwards. Keep the elbows and shoulders parallel. Bend the head back and stretch the neck muscles. Inhale and bend the trunk backwards as much as possible. Now exhale and relax. Keep the thighs perpendicular to the ground. Remain in this posture for 10 to 30 seconds with normal breathing. This asana helps to strengthen back and neck muscles, relieves constipation and back pain, and increases blood circulation to the head and cardiac region. Return with inhalation and sit in Vajrasana. Please avoid this practice in case of arthritis, abdominal injuries, and vertigo. Now, Ustrasana. Sit in Vajrasana. Bring the knees and feet about few inches apart and stand on your knees. While exhaling, bend backward, place the right palm on the right heel and left palm on the left heel and exhale. Be careful not to jerk the neck while bending backwards. In the final position, thighs will be vertical to the floor and head tilted backwards. Weight of the body should be evenly distributed on the arms and legs. Remain in the posture for 10 to 30 seconds with normal breathing. Then return with inhalation and sit in Vajrasana. This asana is extremely useful for defective eyesight, relieving back and neck pain, and is helpful in digestive problems and cardiorespiratory disorders. Please avoid this practice in case of heart diseases and hernia. Now Shashankasana. Sit in Vajrasana by folding legs one after the other. Spread both the knees wide apart. Keep the big toes touching. Inhale and raise your arms. Exhale and bend forward with arms outstretched. Bend forward and place the chin on the ground. Keep the arms parallel. Look in front and maintain the posture. Inhale and come up. Go to Vishramasana in the same reverse order. This asana helps to reduce stress and anxiety. It tones up reproductive organs, relieves constipation, improves digestion, and helps to relieve back pain. Please avoid this posture in case of acute back pain. Now Uttana Mandukasana. Sit in Vajrasana. Spread both the knees wide apart while big toes touching each other. Now raise both your arms, fold it from elbow and take it backwards. Place the palms on the shoulder blades. Maintain the position for a while, then come back slowly in the reverse order and relax in Vishramasana. This asana is helpful in back and neck pain, that is especially in cervical spondylosis. It improves lung capacity and diaphragmatic movements. Please avoid this practice in case of severe knee joint pain. Now Vakrasana. From Dandasana, bend the right leg and place the right foot beside the left knee. Then bring the left arm around the right knee and clasp the right big toe or place the palm beside the right foot. Then take the right arm back and keep the palm on the ground with the spine straight. Exhale, twist your body to the right. Remain in the posture for 10 to 30 seconds with the normal breathing and relax. This asana increases flexibility of the spine, helps to overcome constipation and dyspepsia. Please avoid this posture in case of acute back pain, vertebral and disc disorders, post-abdominal surgery, and during menstruation. Inhale, take out your hands and exhale to relax in Dandasana. Now Makarasana. With the help of your hands, turn around and go to prone position. Lie down on your stomach with feet wide apart, toes pointing outwards. Bend both the arms and place the right palm on the left palm, then place the head on either right or left hands. Keep the eyes closed and relax the whole body. This is Makarasana. This asana is practiced for relaxation in all prone postures. This asana helps in recovery of back problems and cardiac rehabilitation. Avoid this practice in case of pregnancy and frozen shoulders. Now Bhujangasana. Lie down on your stomach, rest your head on your hands and relax the body. Now join your legs and stretch your arms. Now place your hands just beside the body As you inhale, slowly lift the head and chest up to the navel region. Then keep the elbows parallel and maintain the posture for 10 to 30 seconds with normal breathing. This asana is best for stress management. It reduces abdominal fat and elevates constipation. It also helps to remove backache and bronchial problems. Please avoid this asana in case of recent abdominal surgery, hernia, and ulcers. While exhaling, slowly come back to Makarasana and relax. Now Shalabhasana. Lie down in Makarasana. Rest the chin on the floor. Keep both the hands beside the body, palms facing upwards. Inhale, raise the legs off the floor as much as you can without bending the knees. Stay in this position for 10 to 30 seconds, breathing normally. Exhale, bring the legs down towards the floor and rest in Makarasana. This asana relieves in sciatica, lower back pain, tones the hip muscles, and helps to reduce the fat in the thighs and buttocks. Also helps to improve lung capacity. Please avoid this asana in case of severe lower back pain, high blood pressure, peptic ulcer, and hernia. Now Setu Bandhasana. From Shavasana, bend both the legs at the knees and bring the heels near to the buttocks. While holding both the ankles firmly, keep the knees and feet in one straight line. Inhale, slowly raise your buttocks and trunk as much as you can to form a bridge. Remain in this position for 10 to 30 seconds with normal breathing. This asana relieves depression, anxiety, and strengthens your lower back muscles, stretches abdominal organs, improves digestion, and helps to relieve constipation. Please avoid this asana in case of ulcers and hernia. Exhale, slowly return to the original position and relax in Shavasana. Now Uttana Padasana. From Shavasana, while inhaling, slowly raise both the legs without bending them at the knees and bring them 30 degrees with the ground. Maintain this position for 10 to 30 seconds with normal breathing. Exhale, slowly bring both the legs down, place them on the ground and relax in Savasana. It is helpful in relieving abdominal pain, flatulence, indigestion and diarrhea. Please avoid this practice in case of hypertension and back pain. Now Ardha Halasana. From Shavasana, inhale slowly, raise your legs together without bending the knees and bring them up to 90 degrees angle with the ground. The body from hips to shoulder should be kept straight. Maintain this position comfortably for 10 to 30 seconds with normal breathing. Exhale, slowly bring the legs down to the ground without lifting the head and relax in Shavasana. It is beneficial for dyspepsia, constipation, and in cases of diabetes, piles, and hypertension. Avoid this practice in case of lumbosacral pain, abdominal injuries, and hernia. Now Pavanamuktasana. From Shavasana, bend both the knees. Exhale, bring both the knees towards the chest. While inhaling, interlock the fingers and clasp the shin below the knees. Exhale, raise the head till your chin touches the knees and relax. Maintain in this position for few seconds and bring the head back to the ground. While exhaling, bring the legs back to the floor and rest in Shavasana. It removes constipation, gives relief from flatulence, decreases the bloating sensation in the abdomen, and provides digestion. Please avoid this practice in case of abdominal injuries, hernia, sciatica, severe back pain, and during pregnancy. Now Shavasana. Lie down on your back with arms and legs comfortably apart, palms facing upward, eyes closed. Relax the whole body consciously and become aware of natural breath. It helps to relieve all kinds of tensions and gives rest to both body and mind. This asana relaxes the whole psychophysiological system of our body. Now Kapalabhati. Sit in any meditative posture like Padmasana or Vajrasana. Close your eyes and relax the whole body. Inhale deeply through both the nostrils, expand the chest. Then expel the breath with forceful contractions of pelvic and abdominal muscles and inhale passively. Do not strain and continue active exhalation and passive inhalation. Complete 30 rapid breaths and take a deep breath, then exhale slowly and relax completely. It purifies the frontal air sinuses, helps to overcome cough disorders. It is useful in treating cold, rhinitis, sinusitis, asthma, and bronchial infections. Please avoid this practice in case of cardiac conditions, high blood pressure, vertigo, chronic bleeding in the nose, migraine, stroke, hernia, and during menstruation. Now, Nadi Shodhana. Sit in any meditative posture like Padmasana or Vajrasana. Keep the spine and head straight with eyes closed. Relax the whole body with few deep breaths. Then keep the left palm on the left knee in Jnana Mudra and right palm should be in Nasikagra Mudra. That is, place the ring and small fingers on the left nostril and fold the middle and index fingers. Place the right thumb on the right nostril, then open the left nostril, breathe in from the left nostril. Close the left nostril with the small and ring fingers and release the thumb from the right nostril, then exhale through the right nostril. Next, inhale through the right nostril. At the end of inhalation, close the right nostril, then open the left nostril and exhale through it. This completes one round of Nadi Shodhana Pranayama. Repeat for another 4 rounds. The main purpose of this pranayama is to purify the principal channels of carrying energy called nadis. Thus, it nourishes the whole body. It induces tranquility and helps to improve concentration. It also increases vitality and lowers the level of stress and anxiety. It elevates cough disorders also. Now, Shitali Pranayama. Sit in any comfortable meditative posture. Then place the hand on the knees in Jnana Mudra or Anjali Mudra. Now, roll the tongue from the sides to shape it as a tube. Then, inhale through this tube-shaped tongue. Fill the lungs with air to their maximum capacity and then take the tongue inside the mouth and close the mouth. Then exhale slowly through both the nostrils. This is one round of Shitali Pranayama. Repeat it 4 more times. This pranayama purifies the blood and has cooling effect on both body and mind. It is beneficial for persons suffering from high blood pressure. It satisfies thirst and relieves indigestion, digestive disorders caused by bile. It destroys the disorders of spleen and is beneficial for skin and eyes. Now, Bhramari Pranayama. Type 1. Sit in any meditative posture with eyes closed. Inhale deeply through the nose. Exhale slowly in a controlled manner while making a deep, steady humming sound such as that of black bee. This is one round of Bhramari Pranayama. Now type 2. Sit in any meditative posture with closed eyes. Inhale deeply through the nose. Close the eyes with index fingers. Place the middle finger side of the nose. Don't close it. Mouth with ring and small fingers. Ears from respective thumbs. This is called Shanmukhi Mudra. Exhale slowly in a controlled manner while making a deep, steady humming sound of a black bee. This is one round of Bhramari. It relieves stress and helps in elevating anxiety, anger, and hyperactivity. Now, Dhyana. Sit in any meditative posture. Keep your spine comfortably erect. Adopt Jnana Mudra. Touch the tip of the thumb to the tip of the index finger, forming a circle. The other three fingers are straight and relaxed. Keep your palms facing upwards upon the thighs. Close your eyes and sit with a slightly upturned face. You need not to concentrate, just maintain a mild focus between the eyebrows and be conscious of your breath. Dissolve your thoughts and try to attain single and pure thought. Meditate. Meditation is the most important component of yoga practice. It helps the practitioner to eliminate negative emotions like fear, anger, depression, anxiety, and to develop positive emotions. It keeps the mind calm and quiet. It increases concentration power, memory power, clarity of thought, and willpower. It rejuvenates the whole body and mind, giving them proper rest. Meditation leads to self-realization. Sankalpa. I commit myself to always be in a balanced state of mind. It is in this state that my highest self-development reaches its greatest possibility. I commit to do my duty to self, family, at work, to society, and to the world for promotion of peace, health, and harmony.
सर्वे भवन्तु सुखिनः सर्वे सन्तु निरामयाः सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत् ॐ शान्तिर्शान्तिर्शान्तिः